Here are a few case studies that demonstrate the role of pharmacogenomics in psychiatry and neurology. In a study published in the American Journal of Psychiatry in 2013, 1,167 patients with major depressive disorder were randomized to receive either treatment as usual or treatment guided by a pharmacogenomic test panel. The panel included genetic variations in genes involved in drug metabolism and response to antidepressants. The study found that patients who received guided treatment had a significantly higher response rate and remission rate compared to those receiving treatment as usual. The findings suggested that pharmacogenomic testing can aid in the selection of antidepressants and improve treatment outcomes. A case study published in the Journal of Clinical Psychopharmacology in 2011 highlighted the role of pharmacogenomic testing in guiding warfarin dosing in a patient with schizophrenia and comorbid anxiety disorder. The patient had a history of subtherapeutic and supertherapeutic INR, International Normalized Ratio, values while on warfarin therapy. Genetic testing for CYP2C9 and VKRK1 variants helped identify the patient's poor metabolizer status and guided dosage adjustments, resulting in improved INR stability and reduced bleeding risk. In a case report published in Psychiatric Services in 2016, a patient with treatment-resistant schizophrenia underwent pharmacogenomic testing to guide antipsychotic medication selection. The patient had previously experienced inadequate response and side effects with multiple antipsychotics. Genetic testing revealed a CYP2D6 ultra-rapid metabolizer status, which explained the rapid clearance of some antipsychotics. Based on the results, the patient's treatment was modified to utilize antipsychotics that were not primarily metabolized by CYP2D6. The patient showed a substantial improvement in symptom control and tolerability. A case report published in Clinical Neuropharmacology in 2018 described a patient with Parkinson's disease who experienced motor complications such as dyskinesias despite optimized treatment with levodopa. Pharmacogenomic testing was performed to identify genetic variants in the QOMT gene. The patient was found to be a poor metabolizer due to a specific QOMT variant, resulting in elevated levodopa metabolism. Based on the results, the patient's treatment was modified by reducing the levodopa dosage and adding a COMT inhibitor, resulting in a reduction of dyskinesias and improved motor control. These case studies demonstrate how pharmacogenomic testing can provide valuable insights into medication selection, dosing adjustments, and treatment response in psychiatry and neurology. By considering an individual's genetic variations, clinicians can personalize treatment strategies, improve medication efficacy, and minimize the risk of adverse effects. However, it's important to note that these case studies represent specific scenarios, and pharmacogenomic testing recommendations may vary based on individual patient characteristics, clinical guidelines, and available testing resources.